Good to see everybody. Mr. Grove again. We're going to be looking at CPR and the AED for the next 2 or 3 weeks. Hopefully you become efficient at performing CPR and that you don't hesitate in a situation where it could revive or save somebody's life. I want to introduce you to Annie. This is Annie with whom we'd be working with if we'd be in the classroom. Unfortunately, we're not going to meet Annie, and hopefully things get to normal soon that we can get back on campus. I know some of you are on campus now and some are at home. I wish you all the best. Let's welcome some good warm weather and let's get ready for summer. That being said, I want to just show a little bit about Annie if we'd be working with Annie. With the CPR compressions, you can see the area, and let me get Annie centered, would be the sternum area. And what we would do is we would take 2 fingers from the xiphoid process, which is the tiny bone at the end of your sternum, taking those 2 fingers down at that point, and as I try to get in front of the camera, and then putting our heel on the sternum area. We will walk through this today with the video. We will also learn when we have Annie positioned with the head tilt, okay? As well as, the CPR and the mouth-to-mouth working together. So at this time, I'm going to go, that's the screen, and we're going to look at putting in the next piece, and it will be our scene and then the skill practice. So I will pause right now. Okay, we're going to go to adult CPR.
When it comes to CPR techniques, any person over the age of 12 should be considered an adult. No matter a person's age, there are 2 really important numbers you need to know to perform effective CPR. Those numbers are 30 and 2. 30 is the number of chest compressions in 1 cycle of CPR. You give compressions at the center of the chest on the lower half of the breastbone at a rate of 100 to 120 compressions per minute. Push hard, at least 2 inches deep hard, and fast. You might be surprised what giving 100 compressions per minute feels like. It's almost 2 compressions a second. Don't be intimidated. You'll get a lot of practice performing CPR in your missions. Just keep thinking. Push hard and push fast. The next number, 2, is the number of rescue breaths you'll give after each set of compressions. You'll open the person's airway, seal the airway, and give 2 rescue breaths. To provide effective care, it's important to minimize interruptions between compression cycles. Try to keep those interruptions under 10 seconds. This means that once you've completed 30 compressions, you should be able to give 2 rescue breaths and begin your next cycle of compressions in no more than 10 seconds. So, that's 30 compressions, 2 rescue breaths, and repeat. And repeat, and repeat, until the person shows obvious signs of life, an AED becomes available, and no other trained responder is available. You have performed 5 sets of CPR, and another trained responder is available to switch, or EMS personnel take over, you are too exhausted to continue, or the scene becomes unsafe.
Okay, so that summary again, when we think about it, the key ingredients are 100 to 120 compressions, give your 2 rescue breaths after each round, continue the 30 compressions, keep it going without any interruptions, and perform it until the emergency team gets there, EMS get there. If you have another person with you, you could exchange, take turns, but sometimes it's good just to stay in that sequence. So let's go through the skill part, and here we go. Start the mission.
It's time for you to step in and use your skills to help. First things first, size up the scene and form an initial impression.
Okay, remember we always check call care, so we got to check, is the scene safe?
There doesn't seem to be anything dangerous on this side of the room. Everything looks okay over here. No apparent hazards. Good. You've checked the scene, and there don't appear to be any hazards. The scene is safe. While checking, you didn't notice any severe life-threatening bleeding.
Okay, so when we check the individual, what may have caused the scenario, if it's bleeding or whatever it may be. Let's check for responsiveness.
What is the correct way to check for responsiveness?
Okay, the first thing we want to do, the person could be sleeping, but doubtful. But let's just say, are you okay?
Carrie is unresponsive. How do you complete this check?
Okay, after saying, "Are you okay?" you're going to tap on the shoulder, shout again, and look for normal breathing.
Carrie is unresponsive. During your check, you notice that she isn't breathing. Time to contact 911.
So with 911, we're going to either call ourselves, but since we have extra people in the scene, we're going to ask this gentleman, and we're going to send Sam for 911 and get an AED if possible.
I'll call 911, but I don't know where to look for an AED.
Okay, so he's going to go check. We're going to go back. So we did check for responsiveness, and we know. So now let's look at what we're going to start next. Okay, so when you look, listen, and feel, you put your head down on the close to the person's face, tilt your head again, and you listen for an air breath or breathing. You can feel it on your face possibly, and you look and see if the chest rises. So let's start now with performing chest compressions.
To begin, position yourself beside the upper chest. You should be directly over the chest so you don't have to lean to the left or right for compressions. Use the arrows on the screen to position yourself for CPR.
Okay, so let's put ourselves, you can see this where I'm positioning right here. Okay, so I might go not till a little bit too low. Looks pretty good right there. Down one more spot this way. There
Nice
you go.
job. Next, place the heel of one hand in the center of the chest on the lower half of the sternum. Place your other hand directly on top of the first hand and interlace your fingers. Drag the correct hands to the correct spot on the chest for compressions.
Okay.
Not exactly. Use two hands in the center of the chest on the lower half of the sternum. Great. Now you're ready to start compressions. Push hard and fast at a depth of at least 2 inches. You'll need to give 30 compressions at a rate of 100 to 120 compressions per minute. Since you're just getting started, listen to the metronome. It will help you give compressions at the correct pace. The counter on screen will keep track of how many compressions you've completed and let you know if you need to speed up or slow down.
Okay, we're going to go with 30.
Try counting out loud on your own as well. This will help you get used to the rhythm and keep track of
You
your
can hear the
progress.
metronome in the back. Ready? Okay, 30, we're done.
Nice job with compressions. Now continue CPR by opening the airway and giving 2 rescue breaths.
Okay, so we will go to the airway right here. We're going to open it.
Use the head tilt, chin lift technique to open the airway.
So we're going to have the chin and the head.
Good work. Now open the airway.
So we want to take and get the angle, and you can see the degree where the chin is on that line.
You did a great job with that skill. Carrie's airway is now open.
So we would perform 2 rescue breaths.
Now give 2 rescue breaths. Press and hold the mouth for about 1 second to give each breath.
Here we go.
When you
1001, 1002.
You've performed a round of CPR. Now the person you said to call 911 has returned with some news.
I called 911, but I can't find an AED or a first aid kit. The paramedics said they'd be here soon.
From here, you would continue CPR until the person shows obvious signs of life. An AED becomes available, another trained responder or EMS personnel take over, you are too exhausted to continue, or the scene becomes unsafe. We'll stop here, but you'll have the chance to practice CPR again in the next mission.
Okay, class, so what we're going to do is you can watch that 2-3 times. I said about unfortunately we don't have an artificial Annie here to work on. So that being said, I'm going to also add another video to this, and it's going to show some scenarios with cardiopulmonary resuscitation. So we're going to continue this for the next 2 weeks, but make sure you watch this over and over. Remember about the Good Samaritan Act. You say, well, I'm nervous, Mr. Grove. I don't want to approach a person. I just don't think I'm capable. Well, remember the Good Samaritan Act covers you. Even if you were to just at least try and attempt, they know that would have been the right thing to do. The person's not breathing. Um, we want to get that oxygen in through the lungs and, get the blood moving to the brain as best as possible. So I wish you again all the best. And so we'll have a quiz after this and as well as the next 2 weeks. So everybody's back in the saddle. Take care and God bless.